We are going to give a brief information of suspensions regarding the definition, classification, and advantages and disadvantages. Coming to the definition of suspensions, suspensions are heterogeneous system consisting of two phases, a dispersed phase or internal phase, which is therapeutically active ingredient, dispersed uniformly in discrete units throughout the dispersion medium or external phase. The internal phase consisting of insoluble solid particles which is distributed uniformly throughout the suspending vehicle with the help of single or combination of suspending agents. The external phase is generally aqueous in many instances and may be an organic or oily liquid for non-oral use. As we can see in this picture, the yellow color represents the dispersion medium, which consists of red colored spots of dispersed phase or internal phase. Coming to the classification. Suspensions are classified into four types based on the general classes, proportion of solid particles, electrokinetic nature of solid particles, and size of solid particles. Based on general classes, suspensions are classified into three types: oral suspension, example paracetamol suspension, antacids, externally applied suspension, example calamine lotion, parenteral suspension, example procaine penicillin G, insulin zinc suspension. Coming to the based on proportion of solid particles, the suspensions are of two types: dilute suspensions consisting of 2 to 10% weight by volume solid, example cortisone acetate, prednisolone acetate; concentrated suspensions consisting of 50% weight by volume solid, example zinc oxide suspension. Based on electrokinetic nature of solid particles, the suspensions are of two types: flocculated suspension. In flocculated suspensions, flocks that are loose aggregates will cause increase in sedimentation rate due to the increase in size of sedimenting particles. Hence, flocculated suspensions sediment more rapidly. Deflocculated suspensions. In deflocculated suspension, individual particles are settled. Rate of sedimentation is low, which makes it difficult to redisperse by agitation. This phenomenon is called caking or claying. Coming to the last type of classification, that is based on the size of solid particles, the suspensions are divided into two types: coarse suspensions having particle size greater than about 1 mm, nano suspensions. These are biphasic colloidal dispersions of nano-sized drug particles stabilized by surfactants. The size of the drug particles is less than 1 mm. Advantages of suspensions. Suspensions can improve the chemical stability of certain drug. Drug in suspension exhibits higher rate of bioavailability than other dosage forms. Duration and onset of action can be controlled. Suspensions can mask the unpleasant or bitter taste of the drug. Finally, coming to the disadvantages of suspensions, physical stability, sedimentation, and compaction can cause problems. It is bulky sufficient, so that care must be taken during the handling and transport. It is difficult to formulate. Uniform and accurate dose cannot be achieved unless suspension is packed in unit dosage form. Preparation of 30 ml of milk of magnesia suspension. Milk of magnesia is an aqueous colloidal dispersion of magnesium hydroxide. It is prepared by hydration of magnesium oxide. The chemicals used in this preparation of suspension are magnesium oxide, magnesium sulfate, chloroform, and distilled water. Magnesium sulfate is separately dissolved in 6 ml of purified water, and then weighed amount of sodium hydroxide is dissolved in little portion of purified water in a mortar and pestle. Magnesium oxide is added and triturated until it forms a smooth cream. To the solution of magnesium sulfate, pour the dispersion of sodium hydroxide and magnesium oxide with continuous stirring. Finally, make up the volume of suspension with distilled water.